I guess you can start by telling us about yourself and like what you do at CHOC, your role, and what kind of drew you to the mental health department.
Well, I have been at CHOC for 24 years this month, so I've kind of been all over all our areas. Started in med surg and worked downstairs in the clinic. And the cool thing is, I used to work with Dr. Hussey, who's kind of our main psychologist behind this whole mental health unit. And I can just remember her running clinic with hematology and talking to the kids about like their, not only their conditions with hematology, but trying to balance out like their social needs and, you know, if there's any bullying or anything going on, her always saying, God, we need a mental health unit, we need a mental health unit. So just kind of cool to see that whole thing transpire from the talks to, you know, being here now. And I just have a, you know, fond place in my heart because I have a couple kids who of my own that have, you know, some struggles with anxiety and a little bit of, you know, social anxiety, regular anxiety, OCD. So it's kind of dear to my heart, you know. So I knew when we opened it up, I wanted to work here. So I just went ahead and applied, and here I am, almost 3 years later. So just been here the whole time and loving it. This is like my home now. I just, where I'm going to be until I retire.
Yeah, yeah.
Not too far along.
That's awesome. So what's
Yeah.
your like main role here in the mental health department? What's like your day-to-day?
So I'm an MHA, which is a mental health assistant, and really we do everything from helping the kids get their showers ready, getting their breakfast, lunch, and dinner and snacks together, but we also are going to groups with them and sitting there and intertwining with them, and then really being a person that if they're maybe are triggered in group, that we follow them out and just kind of make sure they're okay, or see if they need to go to the sensory room, or maybe just take a little break or go outside, just kind of being a support person between them and then their nurse. And then we all, of course, collaborate together and have team care, but just really be there for the kiddos if they have any issues going on throughout the day that they might need help with.
Oh, great. And one more, I guess, so what's your most memorable, you know, moment with, it can be with a patient or with, as a department as a whole. Is there like a specific moment that you can just kind of like bring up that just kind of like, it's like the most memorable for you? I'm pretty sure there's a lot, but maybe just, there's a lot, yeah.
I do have one kiddo who was, you know, dear to my heart. He was very social anxiety ridden when he came out of his room, and I kind of like those little challenges, so I'd keep going back there and talking to him and say, come on buddy, let's get out, at least sit in the pod, and you know, he wouldn't eat. He was just really, you know, GD, gravely disabled, just couldn't really do his cares or anything. Finally got him out, started getting him to eat a little bit, and then one day I'm like, hey, let's throw some barbecue sauce on there, and then I'm like, hey, let's throw some sugar on there, and then he was like, this is great. So then he'd want to like build this mounds like as extra food, and we would just like mash it up and you know, it was something that you normally just don't get to do, you know, in certain homes. Parents might not allow that. And he'd be like, can you get me another ketchup? Like he was so excited. So when he left, we put together like a little care package of all sorts of like funky things that he could use that as a coping skill, and it really helped him. And our social worker Tian still, you know, touches base with some of the kiddos, and she's like, he's still using that coping skill, like just kind of making creations and getting them through. I'm like, right on, you know. So he just was like really dear to my heart because he went from like one extreme to the other, and he was just like beaming by the time he left. It was really a cool thing to see transpire.
Oh, I love that. So you know, like having unique personalities within the kids, and like
and like some parents wouldn't even think like, you know, letting their kid make a mess, like
right,
you know, that you know, some parents just think either they're maybe a little too strict and they don't like that, but when this mom saw that, she was like, oh my gosh, this is so easy, like you know, sugar or flour, just to let them, you know, putz around with stuff. So it was pretty cool.
I think that's something that I need to kind of like get used to too. I'm a parent myself now because I have a 10-month-old. I think it's just kind of natural to like when they're making a mess, you're like, oh, you're making a mess, right? You know, so I need to kind of remind myself that, like, you know what, I think kids, it's okay to draw on stuff once in a while. It doesn't have to be, you know, like just let them play around, and because they don't know better, but then you don't, you shouldn't prevent them from growing and learning, right? You know, finding out that, okay, it's I shouldn't make a mess and let them find out on their own and just kind of like, you know, clean up, you know, so instead of just telling them, no, you can't do that, you know?
Yeah. And the best thing for your little age group is like your bottom drawer in like the kitchen, just make it a junk drawer that they can play with like the old fashioned like measuring cups and plastic like spatula, and just let them go to town. And they just think that, one, they're in the kitchen with you guys and they think it's cool, and it's just a bunch of noise and stuff they get to play with, and they think they're, you know, messing around with the adult stuff.
Yeah.
So,
I think that's a good idea. I'm gonna take note of that. I'm still learning, you know, I'm still learning. So yeah.
Trial and error.
Yeah, for sure. So let me see. So okay, Nikki can go with the next one.
Okay.
Okay, go ahead.
So I know there's a lot of like rewarding, you know, parts about your job. What would you say is like the most challenging part?
Definitely the challenging part are kids that are, you know, really, really withdrawn if they're going through a crisis that, you know, you're not going to be able to obviously fix the time frame that they're here, but hoping to give them maybe a coping skill that they have not thought of, or just being able to talk to even an adult figure that they feel safe with. You make that little bit of breakthrough with a kiddo is really, really amazing. But you know, some of the kids in psychosis, those are hard ones because, you know, they are really struggling, and you're really having to pull out all, you know, the stops and, you know, patience, and, you know, just keep in mind that it's poor little things going through, you know, a psychotic break. So whether it's drug induced or, you know, just mentally induced, it's just, you know, you kind of just remind yourself where you're at with that person, and the struggles that they're going through, and trying to help them through it.
Okay, so after saying that, I think it's a good segue to this question right here. So what would you like to see in the department in the next 5 years, like you know, something that you would wish like you guys can either accomplish, or a change that you wish can happen that can positively impact the future of CHOC?
Well, we always have a wait list, so I would love to see our department be able to grow and have, I love the fact that we do take the littles, I call them, you know, from, you know, the littles 4 to 17, but it would kind of be cool to have maybe an area or a wing just for, you know, 4 to, you know, 6th grade or 4th grade, just to keep the littles kind of away from the older kiddos, just because, you know, things are said, you can't control, you know, language content all the time. And it just, I would like to see that. And just the fact that we are so busy that I think there's a need and necessity for us to grow just past our 18 bed capacity. So it'd be nice to have a little bit of, you know, division in that respect.
So right now, like the teen, like, I mean, like the age groups are anywhere from like young, I mean, kids all the way up to, I say like what, 16, 17 or before?
Yeah, 4-year-old to 17-year-old. Yeah.
Oh, I see. Okay, so you definitely want to have that division between that, because in like the age group.
We try to like divide them when it comes to groups. So they're in. We have usually groups A and B. Of course, we try to do that, but, you know, every once in a while it's just, you know, not possible. And, you know, it's just be nice to maybe have like a little bit of an area for the younger kiddos, and, you know, keep them away from the older kids, just for P's and Q's.
Yeah, that's true, I think. Yeah, because sometimes, like, you know, like they're just you know, they're much older, and they've their maturity level and everything is not really synced to you, and it's like, why? yeah, I think that would be a good one, actually, that to have that divide a little bit. Exactly. Let me go.
I know that Liz mentioned to me that you, you know, you're an advocate for the LGBTQ community.
Oh, yeah.
So did you want to talk a little bit about that in regards to
Well, I'm a lesbian, so I'm very comfortable like hanging out with the kiddos, and I think that's one thing that is nice to be able to, you know, I have my rainbow earrings on and my little rainbow stuff on here, and, you know, they kind of see that and they kind of like, oh, okay, their guard comes down a little bit, or like my hair is always a pink color, and I'm like, I don't care what color my hair is, but these kids love it, so I'm like, you know, I don't care, I'll just dye it pink and, you know, make it fun for them. But, you know, my son's gay, and I have some transgender people in our family, so I'm really close to my heart with those kiddos. So always kind of, you know, just nice to know that there's someone they can talk to and identify with, because, you know, the worst thing to say is, I know what you're going through, right? When you really might not know what that kid's going through. But I've had a son come out to me, you know, and I've had to come out to my parents, and, you know, I've had you know, one of my cousins, you know, or the transgender. So, there's definitely areas that I feel that I'm comfortable, talking to those kiddos about, and if they want to talk about that, or giving them some good resources.
I got it. Well, I mean, I guess this is like a little bit like off the, I mean, what, like, let's just say like some of the viewers of our, the video, like if there's something that you would just kind of like a word of wisdom of like, if there's a kid out there that wants to come out to their parents but feels like they're ashamed, what kind of encouragement or type of advice would you give a kid to just say like, hey, you know what, like how would you go about doing that or build up that courage to actually come out to their parents when they feel
it's definitely hard with different, of course we all know different nationalities and people that are, it's harder for, I think, for the male population to come out sometimes and stuff. But I think I would say to them, you got to be true to yourself. Life is short. We all know that, with no guarantees. And, if you're not happy, you're not going to be able to be happy within yourself and spread joy to anybody else. It's hard, I know, for some of these kids, but I think if they maybe start with like somebody they're safe talking to and coming out that way, and then build up a little bit of courage to either have that person with them when they tell their parent, or kind of practice to how you're going to say it to your parent, because it's want to blurt that out, and then that way hopefully they can maybe gain a little bit of confidence, and just at the end of the day, I'm a parent, and I think your parent wants you to be happy and be with somebody that you love and that is good to you. And I think that in the long run, that's what, I think all parents want for their children. And I think once they, accept that, and even the kid can give the parents an education about, some of the support for parents too, and have questions, through the LGBTQ community, so maybe just give them like that type of resources too.
Yeah, I think so too. I think just education and is the most important thing, because then a lot of people are preconditioned in a way. Like older parents are like, oh, like they have like a bias towards certain things. They just have to give them the education and like the resources to understand that, hey, like this is it's a normal occurrence and it's not going away. And then it's happening to your son or your daughter, but then like it's okay, it's life. And then like I think learning to understand people will just make you a much more kinder person, and not to accept the things that way they are, but then it's not like it's a bad thing, right? It's everything is everything happens for a reason, and then learning to accept that it's definitely something that we should all like learn and understand. So
and I can't imagine like a parent not wanting, like choosing not to have your child in your life just because they're gay or transgender. It's like it happens. I mean,
it happens. It happens.
It definitely does. But I think sometimes it just takes a hot minute for the parents to wrap their head, like, okay, I'm not gonna have this child in my life, or God forbid, they try to commit suicide, for something so, minimal that, just opening up and having some acceptance would be, having a child in your life. So
True. That's definitely that's definitely something everyone should like just kind of like take note and like learn a lot from. It's world's changing. The world's changing rapidly. It's rapidly changing. So we just have to. We're not like, it's not this. 10 years ago is not like how it was. Like it's times these days not the same. 10 years, 20 years, 30 years ago. It's information is traveling faster. People are technology is changing. Human beings are changing. We just have to like learn how to adapt. Like human beings have to. So it's cool. Let me see. Nikki, you want to end with the final question? I think time is precious. We don't want to keep you waiting. As much as we want to like chit chat all day, we can talk about everything. But we're gonna just ask one more, and I think we're good to wrap it up.
Okay.
So I guess the main thing now is, how would you, I guess, sum this all up, your experience or the department as a whole in like a couple of words or phrases, just so that we can like have some keywords in mind when we're designing our shirts?
Well, I always tell the kiddos when I'm in group with them or we're in community meeting, I say, I'm real big about this. I said, I treat you kids like I'd want my kids to be treated if they were here. And that's kind of like my motto. But I mean, as a whole, this unit is amazing. I mean, we do so much good for these kids, and it's just so nice to know that if they're going to come to the ED and have a crisis, that they're going to be placed here with our unit. So it's just a very good feeling knowing that, like for parents too. I have a lot of parents that will get an admit and they'll just be crying in the hallway while we're at the kiddo in the exam room, and I just kind of come up and I said, you know what? Go home, take a shower. You've got your child. They're in the best place they could be for their condition here, and it's stuff like that. It's just like so nice to be able to convey that to a family. Like, how scary for you to give your child over to these people you don't even know. Like, I wrap my head around that. I'm like, I don't know if I could do that. And I work here 24 years. Like, that's a scary thing for a parent. So it's really nice to be able to let these parents know too that they are leaving their child in the best hands and that we're going to care for them, and they can go home and kind of breathe and take a minute for themselves, what they've been through too.